Hi, good afternoon. Dr. Bautista here. Well, today I'm going to talk with you briefly about one of the most uncomfortable side effects or problems that happen during cancer treatment, and that will be constipation. So, constipation happens because of many different reasons during a cancer treatment. One of the most common ones is that unfortunately many cancer patients are taking narcotics, are taking morphine, are taking oxycodone, are taking different medications that as a main side effects will cause the intestine to basically paralyze. So it's very uncomfortable. This problem, it can go on for days. Unfortunately, patients having no bowel movements, and this can become extremely uncomfortable. Other thing that you need to be careful with is that many times constipation or not having bowel movements happen because a tumor is causing an obstruction in the bowel movement. So you always have to go to your doctor so they can rule out bowel obstructions if we're talking about any type of abdominal cancers. This happens because these medications will occupy certain receptors that will not allow the bowel movement to move. So what we want to do is what we do here in our hospital, or what we recommend here when patients are going through these severe constipation. First of all, hydration is really important. You need to make sure that you drink enough, and very importantly, that the electrolytes are taken, because an imbalance in potassium mainly is going to cause for your bowel not to move. So definitely I will advise you to take some electrolytes or some potassium tablets. Also, what we do here, we do a combination of using something called lactulose, which is it's a natural medication that will cause your bowels to move a little bit more. At the same time, taking a stool softener, something like Senna, or there's many stool softeners in the market, and probably taking it 1 or 2 times a day. You need to be careful because you can go to the other side and cause diarrhea. So definitely that's something that you need to be careful with, and you need to prevent that from happening. And if it happens, obviously one of the main problems there will be dehydration, so you need to go to your doctor if that's the case. So if this doesn't work, probably after 2 or 3 days, then probably you'll have to start doing some enemas, okay? Some people in cancer situations do coffee enemas for liver detox, that's okay. Or you can do a 1 liter soap enemas. Maybe you can try also the fleet enemas, which is a little easier for you to take. But definitely you need to make sure that your bowels are moving, because not having bowel movements, it can be dangerous and obviously extremely uncomfortable, and it can make you go to the ER. There you have it. That will be our recommendations when dealing with constipation. Also, your doctor can prescribe a certain new generation medications to address this problem if it's caused by using narcotic medications for pain. So you can talk about it with your doctor as well. But then, in summary, the recommendation will be good hydration. Make sure that your levels of potassium are normal, or taking some potassium supplementation, taking a combination of lactulose with stool softener, And if that doesn't work, then definitely after 2 or 3 days, then definitely you need to rely on some other mechanical actions like an enema, and that will definitely give you relief. And I think that's all. And if there's any questions, you can always leave a comment down here. If there's anything else that you want me to talk to you about, or any other recommendation that I can give you. Well, thanks a lot, and see you in the next video. Thank you.